Hi, my name is Jackie Wagner. I am a nursing student at MTC, and I'm going to be doing the IV skill with Saline lock. So I am looking at Jennifer Doe's chart, and I'm making sure that she has orders, and it looks like she has an order for an IV along with a Saline lock. I'm looking for allergies. On here it says no known drug allergies, but we will verify with the patient to make sure that that's accurate. So I'm gathering my supplies. I have two 20 gauge IVs just in case the first one's unsuccessful. I have my IV start kit, which has my Tegaderm tape tourniquet and alcohol swab in there, and some gauze pads. I have my extension set, my saline flush pad to put underneath the patient to protect the linens, and my gloves. So it looks like I have everything that I need, and so I'm going to enter the patient's room. Knock, knock, knock. Jennifer. Hi, my name is Jackie. I'm a nursing student at MTC. Looks like the doctor wants an IV with a saline lock ordered for you. So I'm going to go over that shortly with you. I'm going to wash my hands. I'm going to allow for privacy. Have you ever had an IV before? And she states that she has. So just remember, there will be a little bit of a needle poke. The needle does not stay in your arm very long, and we have a cannula that goes into the arm, and that allows us to provide fluids and medications to be administered to you. Do you understand the procedure? And she states that she does. I am talking to her. She seems to be alert and conscious and able to follow commands. If this were a younger patient or possibly an older patient with dementia or Alzheimer's, we may need somebody else to come in and help hold the arm or to help with the procedure. But she seems to be doing well, so I don't think that that will be necessary at this time. So as of this time, I'm going to get all my equipment ready. I'm going to wash my hands. I'm going to open the saline flush, and it looks like the saline flush is not expired and that it is in an unopened package. Looks like the color is good, so we're going to have that. I'm going to open up my extension set. Maybe. So I'm going to verify with Jennifer her name and date of birth. And so she states her name is Jennifer Doe, date of birth 11/5/75. I do verify with her that she has no known drug allergies. So I am going to make sure all air is out. Prime the line, make sure there's no air bubbles. I'm going to loosen the cap to make it easier when I'm placing the IV. Making sure to keep the sterile technique. I'm going to open up my IV start kit. And make sure my Tegaderm is there, my alcohol prep, my gauze pads, my tourniquet, and my tape. I'm going to take off my tape right now. Alright, so as of right now, I'm going to put the Chuck's pad underneath the patient to protect the linens. As I'm doing this, I'm going to put the arm in a dependent position. I want to make sure that there are no contraindications. I want to make sure to use her non-dominant hand if at all necessary, or if at all possible, which I am able to. I want to make sure that she has no contraindications. I want to make sure that we have a proper site. So I'm going to place the tourniquet on her. Now, if we had an elderly patient, we possibly may not need a tourniquet. Or if we have somebody that's maybe undergoing chemotherapy or has weak veins, we may not need a tourniquet. So I'm going to put the tourniquet on. I want to make sure that there's still a radial pulse, which there is. I want to tap the vein to make sure that we get the vein to dilate a little bit more. Looks like we have a really good vein right here. So I'm going to wash my hands. I'm going to put my gloves on. We want to make sure that the tourniquet's not on for longer than 2 minutes. I'm going to get my needle ready. I want to make sure that I loosen the cap. I found a suitable vein. I'm going to start in the middle and work my way out using an aseptic technique, making sure not to touch it again to decontaminate. I'm going to take my IV. I'm going to make sure that it's bevel up. We want to go at a 15 to 30 degree angle. Once we get flash, we're going to go parallel to the skin. I get flash. I'm going to lower it. We're going to advance it with the non-dominant hand. I'm going to occlude the vein. I'm going to retract it, release the tourniquet. We're going to put the saline flush on and attach it. So I want to make sure that I'm going to aspirate to make sure that I have blood flow, which I do. And so once I have that, I'm going to flush, and I want to make sure that it's flushing easily. There's no signs of infiltration. There's no pain from the patient. Once that's in, I'm going to lock it. I'm going to secure with the Tegaderm. And we are only going to go over the catheter. We want to make sure that it's not going over the hub. So once we have that, I'm going to tape it down to make sure that it is properly secured. I'm going to remove the saline flush. I'm going to finish taping and securing. I'm going to ask the patient if she feels any pain or if she's uncomfortable at all. I'm going to write my initials and today's date and the time that I started it, and I'm going to put it near the IV site so they know that when I started it, so they can document anything like that. We're going to make sure that that's secure. I'm going to remove the dirty linen or the dirty towel. So after this, I'm going to remove my gloves. I'm going to wash my hands. I'm going to put the patient's bed as low as it can go. I'm going to make sure that the call light is in reach of the patient. I'm going to see if the patient needs anything else, possibly to dim the lights or anything like that. I'm going to document in the computer where I placed the IV, what gauge I used, were there any complications, the time and day that I put it in. I'm going to dispose of all my equipment. I'm going to put the sharps in the sharps container. The rest of it can go in the garbage, and make sure the patient's comfortable, and I'm done.